ওনার বিষয়টা এবারে আমাদের মাঝে আলোচনা নিয়ে আসতেছেন ডক্টর সাজিদুল ইসলাম সাজিদ স্যার। ওনার আলোচনার বিষয় হবে নার্ভাস সিস্টেম ও রেবিস ভাইরাস নিয়ে। উনি অনেক সুন্দর, আমরা আশা করব উনি অনেক সুন্দর কিছু আমাদেরকে উপহার দেবেন। তো ওনাকে আসার জন্য আহ্বান জানাচ্ছি।
আউযুবিল্লাহি মিনাশ শাইতানির রাজিম। বিসমিল্লাহির রহমানির রহিম। I am Dr. Sajid from Dhap Checkpost More, Homeo Prescription Point, consultant homeopath. So, my dear beloved physician present here, as we are homeopaths, that means we are physicians. So, I think that we should discuss anything in English, because if we are not prepared, so we can't preach our message, especially the homeopath, among the general people in our country and outward the countries. So, my dear beloved physicians, as we know that allied science is very important, especially for every physician, be he is homeopath or allopath, it doesn't matter. So, today's selected topic is nervous system. So, my dear beloved physicians, nervous system is very important, because 2/3 of the human activities are related to nervous system. Suppose when we get angry, when we're upset, so these all are dependent on nervous system. Suppose when we feel anything, when we touch, when we smell, when we hear, all are related to nervous system. Okay, and when we get pain, just a pricking pain, when we get pain, it sends the impulse to the central nervous system, and the central nervous system sends a message to the peripheral nervous system. In this way our body acts. So, my dear beloved physicians, I am sorry to say that I am delivering my speech in English, because it's very important. I think it is very easy, because I think that all the physicians are here completed honors or masters, as so far I can guess, as so far I know, because all the professors are present here. So, my dear beloved physicians, nervous system, actually what is nervous system? Actually, nervous system is the system of network of nerves and fibers of the human body. So, my dear beloved physicians, please write down. You can actually seminar must be only one topic, on one topic. I think that this is a class also. Okay, so I asked I asked Dr. Mujahid bhai to discuss another things, and that is why I have come here to discuss, especially physiology, anatomy, pathology are very important. So, my earnest request to all present here, you study in English. I think it is very easy. Just if you want, just if you study, okay, you can easily shine in your life. So, nervous system. Because I am very nervous today, because I am not prepared, and so I am tagman level best. Okay, nervous system. So, nervous system is formed with nerves and nerve fibers. Nerves and nerve fibers actually just like a network net. I think that you have all seen the net. Okay, that means network. Net means this. I cannot draw nice picture. Okay, please take it easy. This and this. That means it is a network system. Suppose one nerve to another nerve, this nerve to that nerve. In this way, nervous system is formed. So nervous system is formed with two parts mainly. Central nervous system is situated in the brain, and the brain is divided into three parts: forebrain, midbrain, and hindbrain. So 3 parts of the human skull. CNS, that means central nervous system. Central nervous system. PNS. Yes. হবে না? আচ্ছা আচ্ছা। The PNS, that means peripheral nervous system. So nervous system is divided into two parts: central nervous system and the PNS. That is central nervous system. Actually, CNS. It is the brief name. And the PNS, that means peripheral nervous system. Actually, central nervous system is situated in our brain, and the PNS, that means peripheral nervous system, that means remaining part of the body. Remaining part, that means our neck, our shoulder, that means our thoracic, our cervical, our lumbar, our sacral, and our coccygeal. All are related to a peripheral nervous system. Okay, so nervous system is very related to rabies virus. Okay, because if you understand the nervous system very well, so we can easily understand rabies virus. So CNS, that means cerebral nervous system, and PNS, peripheral nervous system. These are very important in our body. And the central nervous system. Can I erase, please? Can I erase? Yes. Okay, thank you. And the CNS, very important. That means central nervous system is very important. Central nervous system is divided into two categories. Number one, the brain. Number two, spinal cord. So central nervous system is divided into two categories: the brain and the spinal cord. And the brain, can I erase, please? Yes. Okay. And the peripheral nervous system. That means PNS, peripheral nervous system. Peripheral nervous system is divided into two categories. Number one, somatic nervous system, NS. Number two, autonomic nervous system. Actually, somatic nervous system and autonomic nervous system. Somatic nervous system are related to the cranial nerves. And autonomic nervous system, actually autonomous. Auto means self, and nomos means governing. That means self-governing nervous system. That means heart, that means liver, that means kidneys, because they all work themselves, okay, without the help of others' body. Suppose I am moving my hand. This is somatic nervous system. Somatic, that means body. Somatic, psychosomatic. Psychosomatic is psychosomatic disorder is called disease. Psychosomatic, that means somatic and psychic. Somatic, that means body. Psycho means that's mental section. So, my dear beloved physicians, can I erase? Okay. My dear beloved physician, actually nervous system is very huge area. It is very critical area, and you can see that in our Rangpur region very few neurologists. Why? Because this is very critical area. Because the scientists are still discovering the action of our human brain. Because if we discover, if we research all through our life, we cannot find out the actual activities of our brain, because we have got only some action. And the somatic nervous system, SNS, because all are very superior years present here. So excuse me please, and forgive me if I have any mistake, and if I provide wrong information in front of you, then please forgive me and take it easy, because I am also a learner. Just I try my level best to learn something and to deliver in front of the audience. Okay, let's come to the main discussion. So somatic nervous system. Okay, somatic nervous system. in your practical life, when you deal with the patient, so when the patient tell their problems in front of you, in front of the physician, you can easily understand actually what is the problem and what to treat the patient. Because doctor can say what is to be cured in the patient is the main thing. What is to be cured in the patient is the main thing. That means mesmeric treatment. Mesmeric treatment is the very real treatment, because Dr. Hahnemann, after research of 12 years, he discovered miasm. So it is very important. Okay, because we do not follow organ of medicine, very important. Organ of medicine, so that means the system of homeopathy total. Okay, so SNS, that means somatic nervous system. Somatic nervous system is divided into two parts: cranial nerves and spinal nerves. Number one, cranial nerves. Number two, spinal nerves. Number two is spinal nerves. The cranial nerves actually are related to the head of the brain. Cranial nerve, that means cranial. That means covering of our skull is called cranial. So it is related to the head of the brain. And in the other hand, spinal nerves actually remaining parts of the body. It is related to the remaining parts of the body except our head. Okay. So my dear beloved physicians, and the cranial nerves, my dear beloved physician, you should not write, because you have only I have made a notes for you. Okay, just you copy it. And the cranial nervous system, cranial nerves, and cranial nerves is divided into three parts. Number one, sensory nerves. Number two, motor nerves. A sensory nerves is very important for rabies virus. Okay. Number three, mixed nerves. Sensory nerves actually, sensory nerves, they receive messages from the remaining parts of the body and send it message to the central nervous system. Again, I say the sensory nerves actually, they receive message from the body part and send it to the central nervous system. And in the other hand, motor nerves, it sends a message from the brain to the remaining body part. That means sensory nerves receives message from the periphery area. Periphery, that means other areas of the human body except our brain. And the motor nerves, it sends message from the periphery to our central nervous system. That means vice versa. Can you know what is vice versa? Vice versa means suppose we have a coin, the back part and the front part. Back part and the front part is called vice versa. It is an example. Can I erase, please? Okay, sensory nerves, actually I can give an example. Sensory, that means our optic nerves, our olfactory nerves. Optic nerves, that means eye related. Olfactory, that means nose related, because all the action are completely dependent on olfactory nerve. Suppose when we smell, it is completely dependent on our olfactory nerve. And in the same way, optic nerves is also related to our eyes, because all the eyes function is completely dependent on our optic nerves. And motor nerves, that means vagus nerves. Vagus nerves actually situated in our abdomen cavity. In our abdomen cavity, it regulates our heart rate, it regulates our digestion. That's very important. And Naxbom is one of the best remedies. Okay, and earlier we know that because the Naxbom regulates the vagus nerve. It increases the action of our vagus nerve. But at present, from our beloved Dr. Shamal Kumar sir, the Carvos is the main medicine. Carvos is the main medicine. Carvos is the main antidote of all medicines, both for allopathic and homeopathic drugs. So, my dear beloved physicians, and the mixed nerves, that means nerves can be both sensory nerves and motor nerves. Suppose pharyngeal nerves, that means pharynx, oropharyngeal nerves are related to mixed nerves. That means they act both sensory nerves and motor nerves. Can I erase, please? Yes. And the spinal nerves, very important, spinal nerves. Spinal nerves. Spinal nerves, actually spinal cord is situated our below the hindbrain. Below the hindbrain, our spinal cord is situated just before the oblongata, medulla oblongata, behind the medulla oblongata, that is below the medulla oblongata, our spinal cord is situated, and through the coccyx, our coccyx area. Okay, suppose this is a human body. I cannot art, just I am trying my best. Okay, that means coccyx. That means coccyx area. Okay. So spinal. Okay. And spinal nerves are divided into 5 parts. Number 1, cervical. That cervical nerves. Because we have many patients for cervical spondylitis. It is related to cervical nerves because the nerves of the cervical area is damaged or injured. So many patients you will find in your chamber. Cervical nerves. Number 2, thoracic nerve. That means the thoracic cavity. Okay, that means chest. Thoracic cavity. Number 3, lumbar nerves. Lumbar, that means our waist related. Actually, this side to this side, lumbar. That means this is thoracic cavity, this is abdominal cavity, that means lumbar region. And number 4, sacral nerves. Sacral nerve, this point is sacral. Okay, and below the sacral region, the coccyx is situated. That means coccygeal nerve. The number 5, coccygeal nerve. That means cervical nerves, thoracic nerves, lumbar nerves, sacral nerves, and coccygeal nerves. Okay, I am erasing. Autonomic nervous system. That means I have earlier discussed somatic nerves and now I shall discuss autonomic nervous system. Autonomic nervous system. Okay, the auto means actually self and nomos means actually the word auto comes from the word self. That means self and nomos. Nomos means governing, that means self-governing without help of anything. This systems works. And autonomic nervous system is divided into 2 categories. Number 1, sympathetic nervous system. Number 2, parasympathetic. Okay, sympathetic nerves and parasympathetic nerves. Actually, sympathetic nerves are related to sympathy, actually sympathy, that means what is the Bengali meaning of sympathy? Daya, sahanubhuti. Okay, so sympathetic nerve actually it increase our heart rates. All the high. Suppose when we get angry, then the sympathetic nerves acts. The sympathetic nerve acts when we get angry. That means when we are hyper. Okay, so it the sympathetic nervous system actually acts there, and the parasympathetic nerve actually it decreases the heart rate. Suppose when your pressure is high, so it controls parasympathetic nerves, and it also another word is that about sympathetic nerve. Sympathetic nerve, that means decrease your digestion, digestion, and in the other hand, parasympathetic nerve increase your digestion. That means suppose if you have digestive problem, so parasympathetic nerve works here. Okay, suppose you feel very tension here. Okay, suppose you have been suffering from hypertension. Okay, and when your pressure is very high, and then parasympathetic will work to decrease your pressure level. Okay, so this is all over nervous system. It is very brief actually discussion, because nervous system is very huge area, huge discussion, because it needs minimum 10 to 12 lectures to complete. Okay,
we'll get another
inshallah. Actually, nervous system are related to excitement, related to emotion. Why are so emotional? Why are so excited? So all are related to nervous system. So my dear beloved physicians, and now I shall discuss about rabies virus very briefly, because we have very short time. Okay, within short time I have to complete. Rabies virus. It is also called Lissa virus. It is also called leptovirus. So the familiar name is rabies virus. It's very important, because Dr. Shamil Kumar Sir has gifted us about rabies virus, because how much rabies virus can attack human body, and it can penetrate the DNA system, and distorted babies can be born. Okay, suppose when we see a disabled baby, I think we can, if we just analyze it, we can see that the actual cause of the disabled babies is liable to rabies virus, is responsible for rabies virus. So rabies virus, actually it is a virus. It attacks the central system. Earlier I have discussed. So and earlier I told you that this is very important. Nervous system and rabies virus is very important. So rabies virus, that means it attacks the central nervous system. Number one, central nervous system, it attacks the central nervous system. When a dog bites in your legs, that means your leg is periphery region. That means peripheral nervous system. When a dog bites, and through the saliva of the dogs, it penetrates our muscle or skin. Okay, and through the peripheral nervous system, it reaches to our central nervous system. So fast it penetrates, that means it attacks the peripheral nervous system, and the peripheral nervous system receives the virus, and it sends to our central nervous system. And after the central nervous system, it spreads all over all around our body, all through our body it spreads. Number one. Number two, peripheral, PNS. That means through PNS it reaches the central nervous system. Okay, and after attacking the central nervous system, it spreads in our whole body, such as salivary gland, it attacks, and that is why saliva secretes of the infected man. So saliva gland. Number four, that means salivary gland. So sensory nerves, it attacks also sensory nerves. In this way, the way the rabies virus spreads its action and that is why day by day, actually, Dr. Shamil Kumar sir says that. Dr. Shamil Kumar sir says that suppose a dog bites you, so it has chance only 10%. It has chance only 10% to manifest the symptoms. Okay, but it has greater chance for your offspring, for your offspring, for your next generation, 90%. So it is very, very important, because if you have a predominant rabies virus in your body, so no medicine will work. And Dr. Shamil Kumar sir has proved that in front of us. Actually, what we get patient in our chamber, in your daily life, so when we cannot cure the patient, what is the reason? The reasons are two: PTS, that is post-trauma syndrome, and post-rabies virus. That means post-rabies syndrome. So later I shall discuss about post-rabies syndrome. I had actually a lot of information about it, so I am very sorry. And in the next class, I will try my level best to discuss elaborately about nervous system and the rabies virus. And I have written a note for you. If you want, you can collect this, okay, by copying. Okay, thank you all. Thank you very much, and pray for me to Allah. And have a nice time. Yes, thank you.